Welcome to today's lesson on myocardial infarction, percutaneous coronary intervention, and coronary artery bypass grafting. Understanding these topics is essential for your nursing practice and NCLEX preparation, as they represent core knowledge in cardiac care. Let's review our learning objectives for today. We'll start by understanding the pathophysiology of myocardial infarction, then learn to identify its key signs and symptoms. We'll cover important diagnostic criteria and explore treatment options, including a detailed comparison of PCI versus CABG. Finally, we'll discuss crucial nursing interventions for each procedure. Myocardial infarction, commonly known as a heart attack, occurs when heart muscle tissue dies due to insufficient blood supply. This happens when coronary arteries become blocked, usually by a blood clot forming on top of an atherosclerotic plaque. Without blood flow, the affected heart muscle becomes ischemic and, if not treated quickly, dies permanently. When it comes to recognizing MI, classic symptoms include crushing chest pain or pressure that may radiate to the left arm or jaw. However, it's crucial to understand that not all patients present typically. Some experience shortness of breath, nausea, and vomiting. Diaphoresis and anxiety are also common symptoms. Remember, atypical presentations are more common in elderly patients, women, and those with diabetes. Understanding risk factors is crucial for prevention and assessment. Modifiable risk factors include smoking, hypertension, diabetes, and obesity, factors patients can control through lifestyle changes. Non-modifiable factors include age, gender, and family history. Being aware of these risk factors helps in both prevention and risk assessment. For the NCLEX exam, you must know the key diagnostic criteria for MI. These include specific ECG changes, particularly ST segment elevation or depression, elevated cardiac enzymes, and significant changes in vital signs. Understanding these criteria is crucial for quick diagnosis and appropriate intervention. Let's focus on ECG changes in MI. ST segment elevation is a hallmark sign of STEMI, indicating full-thickness myocardial damage. Pathological Q waves develop after tissue death, while T wave inversions may indicate ischemia. Understanding reciprocal changes is also crucial, as they help confirm the diagnosis and locate the affected area. Laboratory markers play a vital role in confirming MI diagnosis. Troponins 1 and T are the most specific indicators of cardiac damage, rising within 3 to 6 hours of injury. CKMB levels also increase but are less specific. Myoglobin rises earliest but is also less specific. Regular monitoring of these values helps track the progression and extent of cardiac damage. Initial management of MI focuses on stabilizing the patient and preventing further damage. This includes immediate oxygen therapy if saturation is low, appropriate pain management, and continuous vital sign monitoring. Establishing IV access is crucial for medication administration and potential interventions. Anticoagulation and antiplatelet therapy are cornerstone treatments in MI. Heparin prevents further clot formation, while aspirin and clopidogrel work to prevent platelet aggregation. Each medication requires specific nursing considerations, including monitoring for bleeding and maintaining appropriate therapeutic levels. Beta blockers and nitrates are essential medications in MI management. Beta blockers like metoprolol reduce heart rate and blood pressure, decreasing oxygen demand. Nitrates, particularly nitroglycerin, dilate coronary arteries to improve blood flow. It's crucial to monitor blood pressure closely when administering these medications. Percutaneous coronary intervention, or PCI, is the primary treatment for STEMI. This minimally invasive procedure can quickly restore blood flow to the affected area, making it the preferred option for many patients with acute coronary syndrome. During PCI, a catheter is inserted through the femoral or radial artery and guided to the coronary arteries. Contrast dye helps visualize blockages. A balloon is then inflated to compress the plaque, and usually a stent is placed to keep the artery open. The procedure ends with a final angiogram to confirm successful treatment. Coronary artery bypass grafting, or CIBG, is typically reserved for patients with complex coronary disease. This surgical option is often preferred for patients with multiple vessel disease, left main coronary artery disease, or diabetes with complex lesions. The CABG procedure involves several critical steps. After a sternotomy, bypass grafts are harvested, typically from the saphenous vein or mammary arteries. The patient is placed on cardiopulmonary bypass, allowing the surgeon to attach the grafts to create new pathways for blood flow around the blocked arteries. The procedure concludes with careful closure and monitoring. When deciding between PCI and CABG, several factors must be considered. PCI offers advantages like being less invasive, having a shorter recovery time, and providing immediate results. CABG, while more invasive, may be better for patients with multiple vessel disease, diabetes, or complex coronary lesions that aren't suitable for stenting. Nursing care before these procedures is crucial for success. Complete a thorough assessment, including medication review and MPO status verification. Ensure proper IV access is established and provide comprehensive patient education about the procedure and expected outcomes. Post-procedure monitoring is intensive and requires careful attention to vital signs, cardiac rhythm, and access sites. For PCI patients, focus on the insertion site for bleeding or hematoma formation. CABG patients require monitoring of chest tubes, surgical sites, and hemodynamic parameters. Watch carefully for post-procedure complications. These may include bleeding at access or surgical sites, infection risk, particularly after CIBG, cardiac arrhythmias, recurrent chest pain, and respiratory issues. Early recognition and intervention are key to preventing serious complications. Remember the heart mnemonic for MI assessment: history of present illness, ECG changes, arterial access preparation, risk factors identification, and treatment plan development. This tool helps organize your assessment and ensure comprehensive care. Let's practice with an NCLEX-style question. Question 1. A 65-year-old female patient arrives at the emergency department with complaints of extreme fatigue, nausea, and jaw pain. An EKG is performed and cardiac enzymes are drawn. The nurse knows these symptoms may indicate gastric reflux, panic attack, myocardial infarction, pectoris. Correct answer C, myocardial infarction. Rationale. Women often present with atypical MI symptoms, including fatigue, nausea, and pain in the jaw, shoulders, or back. It's crucial for the nurse to recognize these as potential signs of a heart attack. Question 2. A patient has just undergone a percutaneous coronary intervention, PCI, via the femoral artery. The most important post-procedure nursing intervention is to A. Encourage the patient to ambulate to prevent DVT. B. Monitor the insertion site and assess for distal pulses. C. Administer aspirin to prevent reocclusion. D. Elevate the head of the bed to a semi-Fowler's position. Correct answer B. Monitor the insertion site and assess for distal pulses. Rationale. The primary risk after a PCI is bleeding at the insertion site or a reocclusion of the artery. Monitoring for bleeding and checking distal pulses, perfusion, are the most critical nursing interventions to ensure patient safety. Question 3. The nurse is caring for a patient post-CABG surgery. The patient's blood pressure drops to 85/50 mm Hg. The nurse recognizes that this finding may lead to which complication? A. Bleeding at the graft site. B. Collapse of the new graft. C. Increased cardiac output. Hypertension. Correct answer B. Collapse of the new graft. Rationale. Following a CBG, a patient's blood pressure must be kept in a narrow therapeutic window. Hypotension, low blood pressure, can cause the new graft to collapse, while hypertension can cause bleeding. Let's review our key points. Early recognition of MI symptoms saves lives. Know your diagnostic criteria and treatment options. Master nursing interventions for both PCI and CIBG. Always monitor closely for complications and know when to intervene. Thank you for your attention today. Remember to utilize all available resources for further study and keep practicing these concepts to build your confidence in cardiac care. Visit our YouTube channel, Study Nurse IQ, and subscribe for more nursing content and practice questions.